Yat shikado shidene. Aden hana that si yo gizido that isunol tsai that ntsade ajena ol kikodo ashi ni kede de ne glin de jokwa na nishta holoni benna satout a oyo keden that ni gle konde ado shi it eda ihe masando ni nalledo ni kein lini bahanada so gizi ko alta ko do to de zin lini be a ne in ko to di zin shi dole ko den ho jon dole na stan shama ya de hil zlistan twistan chal hil khayol khas no de tsui halt ki halt wan na dal ke na dal tsui trade din ani sa ana rebik a ho jon ni yajen e wait ni glon ho di bini bi tona dilzen don't na ini kan Rashin zade de kui his kanye da shen kwa hon de kwasnas et at da pedit non hitrahntni e di stingi bi kadita adon hit ad winsen ni hit adol da Rashine la kon hit ne end lini kon hit hata da ka ich hata alnido ich da betske on ha insen ni he e don hit desni go hon nasko net neje nane tatole ina ya at ehibe hiena da iltinto enitsen kon ni hidene etan lini kon da tsade di de nebel gehad so hon yi tabarani do khashine la hikedan lini nizade ndal neshto da altra ado khashine la kon hicham da pa ya at eko bekon lodole tsada asta asizno adon hi masan ni hiche ni hi man hi je ni hi maya je ken hi ta akeda dan lini na antkin betado de deli hon ya at eko hon ben antkin lini kon ni hin sa kes is zolo iosen ni hin na hat a trolo iosen nasko ne jebe ina ananel idole nasko ne jebe se na de ni zendole shaman hassan yadil di yin ne etan lini kon o yugo ben total zen la nan de kon ni hidden en lini kon belashla in lini hon ya at eko bes na hast adole Bagan has ango bekont dat clip begonesh gishnas tranko betrotnas kango betisk enas lago ya at ehon hisn dahot atole ado kodonas go ne jehon hits is lini hon ni hits is gedacht en deint ladon hits is dat betsketole ni hit desen das ligo chian chil ini ya at chian chil indole be eta ahuilian dole ni hits is Adon hit ostant ohon hit dokta dan lini ya at ego konha ishi do ya at ishi hit aj wing idole jo kodohon ben na tin oko ado di alalaj na khatel nishi izel in izetni ka salam lini kon at ya at hon kingon net dan dal nishi ya at na khabas won lole adon hinat an lini atro ni hinat ani lido tsalate nat ani be inat nazlani ho yitahi nani ba achina alaji ke itni na gai arts ma babenashni dole ni hibesh bahasa anin hitrat naznele ke yapenat an lini tne sg be dabet ojini ultra nas ango arts ado ze el ide na has trani ni hidne edan lini khadat endas de onjonon hichit ehes kedole ni hilkojon ina wolieni ho be hiena da iltintole sa yat ehi be chi anna de titole sa ba hojoni be nani edole kun sago e to de zenlini an shende be hanana si dole kon askonta is en kompensatan jono ye eta idole na khatan zendob ye eta khoni zi dole kon sa lini yat ehi kon ni hichotal ido ye ni khatan zendole beto khoto be khaini no di na kon hit na etan lini asco but to de zenlini ho ba be hanana si dole di de ben hit wajon hasli na hi ha shik edo shidne ko hanada se yo gizi bi je konti the modo na kijingo net di eyakon atabi to ta etahne nasko net ne je kodon hina antin lini kujin hiche hunane net ole kodoshi en hina tan lini President Jonathan Nez itselin lini kodo nihicha hanado zito kodo hanne and lini hicha nadi ni ado na hone ke tasdanon ezel inja da inishja ajo ta e kodo nihicha na di ato joshi da isnot ato nihizad lini ashon de shikedo shne nicha apen se kes bi ita any bahanosen hinat ani bahanosen ado kodoya da tido yo ta hino no ta ejo an hini tashte nadika any hidesh kilch edo shidne ako ado ekwa ni hinat an nishi bitnadi. At this time, I'd like to thank all the listeners. Thank you for tuning in. We kindly respectfully request for your respectful words on our social media. At this time, we'll hand off the floor to our president, Jonathan Nez. Mr. Nez, tele.
Thank you, Dr. Fowler. Thank you for the prayer. Ado ashi tskitlogo kodo hanet yije kode shlish eno cleaning jo kodo shideche ashin ein shlindo tratne sani bashish chindo tredchini da shiche tredchini da shanale ado diga trat nache niginat ani large president han shlon ado hot ya nacha ratni te trat nache da aro di nalnigi di nihaishin yilni just ini ishi ya don yilbels no jo naharani de do ade haishin yilni benache bikje inde bashk in oslini konde ska je jonago ya nishidas on di bikje in de part de konsentragene hast nicht nanish dasagi by henits in kodo office of the president vice president was on the ado di ta ishi but ado nanasne omicron will yego akonde the way la kon yikeni ne zel in the hast gerade but ado die hinanisch de inigi di wa master de ido ado ze nicht alia ze bikjena nishigi di nasligi nachada as lai kon ikeni nebada se ich trago do nachada atseta noda edo lana nachada nits mashwonen nachada atse judi nasligi edo die schinlo na chekodon nicht aber zinie dik na kinacha yaishni do di shlatin hahot zorgo do yaishni do ni keya pakad nani klini ishi ya kon bansada kes do di je master das do hand sanitizers do dasi ni di de kushi kontra na zala das zorgo akon nsi krito ze nachada atseta di no do di mask do dat egi do de ni hand sanitizers do do be clean dal inigi do dasi ni ishi kwich ahot yena nishidel indo les don le Washington go shnabel vice president Lizer nalsos nije bakailia di ni ze do ni chi gedast gi mask gi Sani hije koda do shishta bidi no Washington kinslikoisa ajanat aidan ligi large the Sadagi President Biden do Kenneth the Sadagi Vice President Harris not aidan ligi ashon hije hane hije konda yitla asha the mail so hanelt di mask kon hije kodalia adon hije kodalia gi shi kon asha ne zetinga ba anezna Kana zala hatas zogo ebiche kodal netole ein de nitole kana zala nahan hinat ani dan linigi. So one $1,000 mask sa danosano enle di nak the mogon that she which could neto le so edi ishi de no kedo le kanazana kindazalo not ani dan lingi so oni ni jashane ishla do le do ni is do ba da hosya do le di no to dj ko carry wato le na o dishi zel insa ajana nish is ikdes ido zel in ado kdoya kon ya ani hijashane illehgi ya di chiyan khayat egi chadas ido ado ni isto ba da hosya das che ado dida le isigi ba da hosya jo jetzt ist bezilo di stoit inigi nas ich do nicht dos natta jo do ya da kitan le schladin hat so nicht geschehen nicht da jetzt ist bezilo di stoit ini do nicht do was da nicht tra den es geht do lesch in thing so ne do nicht kuile do lesch. You know, we want to give you an update with the first slide here, just giving you an overview of everything. You know, 54 cases yesterday here on the Navajo Nation, no deaths, but there was a report of some delays, 12 cases and 2 deaths from prior. And the reason why that happens is that, you know, they have to do the investigation. Is it COVID related? You know, sometimes the investigation does take a lot longer, and sometimes those delays come later, and that's what happened yesterday. Overall, 1,623 deaths. Our thoughts and prayers go out to our Navajo citizens, you know, for going through the deaths, and even also the people that are getting sick, that have been affected by COVID-19. Thoughts and prayers go out to them for quick recovery. I also want to mention too that today we're going to take a different focus on our town hall. One, we want to get you information to take better care of yourselves, take better of your body, and, you know, strengthen your immune system. You know, it's going to be spring pretty soon. It's going to warm up. There's opportunities for physical activity, and also, you know, eating good foods, strengthening our immune system so that we can fight off, you know, sickness and keep our body strong against catching this COVID-19. In our very own Kerry Watto from Nutritional Healthcare Facility, who is a registered dietitian, will be giving you a presentation, and Dr. Fowler will be helping with the translation today. Of course, we'll be getting updates from Dr. Jill Jim and also from the IHS and our Epidemiology Center, Del Yazi. I also want to update you all on the letter that we sent a few weeks ago to the White House asking for more masks, because, you know, those free masks that people are sending off, or even the test kits, you know, sometimes it takes a while to get the test kits and the mask to your P.O. box. And so for the mask, we asked for some masks. They are giving us 1 million masks. And so this week and next week, we'll be working with the Division of Community Development through the Health Command Operations Center, the HCOC, to start delivering masks to the 110 chapters so that they the chapters, the officials there can begin to hand those masks out to our Navajo citizens. You know, we've been doing that for some time with the masks that we have had delivered to us, and you know, it is just one of us, one team that's been going around encouraging people to get vaccinated and handing out masks, hand sanitizers, and bleach. But I know with the big shipment of 1 million masks, we'll be able to get the chapters involved so that we can reach as many more people and get them those protections, those PPEs for them. So just wanted to get you updated on that. And Dr. Jim will also add a little bit more to that announcement. Our second slide just shows you the progression, and you can see now that there's been a drop in cases, daily case counts. It's happening all across the country. Flattening of the curve, and starting to see a downward trend. And yesterday with 54 cases, we're seeing a downward trend. But again, you can't let it up. Continue to wear your masks. See, I think we let up as a nation, the United States, and we saw these high cases. And of course, Omicron is very contagious as well. So we just need to continue to push back on COVID-19 by wearing your mask, social distancing, washing your hands with soap and water, using hand sanitizer, staying at home as much as you can, and getting your vaccination. If you look at the third slide there, it just shows you the progression of COVID-19 throughout these many months, starting February 1st of 2020 all the way to February 1st of 2022. And we just need to stay the course. And then with the booster shots on the slide 4, we encourage everyone to get their booster shots. Look at your vaccination cards. If it's past 6 months now, you can get your booster shots. Slide 4 just tells you Navajo Nation residents that are fully vaccinated. All residents, that's all Navajo Nation residents that use the healthcare facilities. And a lot of Navajos do live off the Navajo Nation. They get their healthcare on the Navajo Nation or using these IHS facilities. So that's 64%. But those that are living on the Navajo Nation that are actual residents, ages 12 and up, 74% of our people are fully vaccinated. That's your first and second shots. Boosted, look at that, 50%. So we really need to encourage our family members to get their boosters. I know some may have gotten their second dose maybe a month ago, 3 months ago, 5 months ago, and you're still waiting for the 6 months to get your boosters. We understand that. That's the reason why the booster percentage is very low, but we encourage everybody to get their third shot. And you know what? Fourth shot is coming. It sounds like there's going to be a booster again every 6 months. So we encourage everybody to consider that. Slide 5 just shows you the progression, the comparison between the United States and the Navajo Nation. And you can see towards the right side of slide 5, it's kind of similar in the large increase in cases. So it's not just here on Navajo, ladies and gentlemen. It's all across this country. Slide 6 just shows you the comparison between the 4 states. And looks like Navajo Nation this week has gone above Colorado. So let's keep those numbers down in our communities. The highest red bar there is Arizona. The one right underneath, the red bar right underneath Arizona is New Mexico. Right underneath New Mexico, a little bit ways down, is Utah, that red line. And then the yellow is the Navajo Nation. And right under the yellow, that red bar is Colorado. So Colorado's seen significant decrease in cases thus far. So ladies and gentlemen, we Want to give you an update thus far on what's happening here. We're going to continue to give you an update because COVID-19 is real. It's still in our communities, and it's still taking our people, and people are still getting sick. A lot of those people are unvaccinated, there's so much rumors and misinformation out there from every angle. And we just want you to know that, you can see here on the Navajo Nation that vaccines do work. Vaccines do work to push back on COVID-19 and slow down the spread. We want to stop the spread here on Navajo. We encourage everybody to get their shots. And today we got the Vice President giving us an update. Right after Vice President, he will be introducing the dietitian from Nutritional, a registered dietitian, Terry Watto. So thank you for watching today. God bless you. Take care of yourself. Continue to wear that mask. And I'll turn the time over to our Vice President of the Great Navajo Nation, Myron Lizer. Thank you for your leadership, Vice President. Take it away.
Oh, yeah. Thank you, Mr. President. Yat Benim, Vice President Lizer here. Comanche Nishlet, Bashas team, Comanche Deshache, Asha Deshanal. It's good to be with you all here on the February 8th rendition of our COVID-19 Town Hall update. It's been a while for me. I've been out and about traveling with our RDC committee, meeting with congressmen, senators, and the like, advocating for infrastructure and many issues that are on our nation, and so joining forces there with our RDC was good. So thank you for joining us this day. As we always do, we give out vital information, pass it along to you, the data, new updates, and the numbers, what Omicron is looking like abroad in our immediate vicinity, in the Four Corners, Southwestern United States. The President is right. Today is a good day. The theme of the day to really advocate for our people all across the Neta to keep in mind that we all could become a little bit more healthier. If you remember early on in this pandemic, President and I challenged you all, as new as the virus was, right? We didn't know much about it, and we were just responding in ways, masking up, social distancing, staying home, staying safe, saving lives, and you've seen the messaging progress a little bit, but almost immediately, just living healthier might be one of the areas where, if we have stronger immunity systems, our propensity to stave off the virus and the full effects, detrimental effects on our bodies and our health systems, we had a greater chance. And knowing too that those with predisposed health conditions really had to fight hard and endured extreme hardship, and over 1,600 of our fellow Diné people have succumbed, have gone into the spirit world because of just that, and others. I mean, the Omicron, you can't really explain why some are doing well and some not, and I've had members as well as president, and many of you have members of our families who have contracted the virus. Our prayers are strong. As a man thinks in his heart, so is he. Biblical scriptures keep me strong. And many of you all too, a full reliance on our Creator, Shajat, and God, is really preeminent now, and should be. We'll work like it depends on us, but pray like it depends on Him, which it does. To keep us protected, to deliver us, to heal us. He is our great physician. On and on. And so, advocates of living healthier lifestyles is truly a central message in which we put out there for you all to consider. It's very vital. I remember March, April, May, June, we sat on many meetings. We couldn't meet, and started to run a nation. And WebEx and Zoom became the norm. All the social, all the platforms that we have at our disposal to have meetings, to conduct meetings. And being leaders of the Navajo Nation, any one day we had 10 to 12 to 15 meetings being on and sitting in front of our computers any one day, maybe up to 15, 16 hours, just having meeting after meeting and meeting. So it was my experience to, the kitchen was right there. The snacks were right there. The sodas were right there to really, I remember immediately putting on 20 pounds. And yet right outside my back door was people running the trails, and was so longing to be one of them. As you know, President and I were pretty active ourselves, runners, and just loving the outdoors. And so it was starting to just weigh on me. I need to be out there. I need to be out there. But still, there was that question. I don't know if I can. None of them are wearing masks. Can you do that? Can you do all that? So, forums like this here is vital to pass out information. And today will be no different. We'll hear how changing your daily eating habits and changing your lifestyle, living a healthier lifestyle, can help again increase your immunity to viruses, increase our stamina, and increase our ability to stave off infection and live a healthier life. Those are things that we should be advocating for anyway. You don't have to be in a pandemic to do that. And we have, and we continue to do so, bring on new supporters of that, new proponents of those that desire to live healthier. If a pandemic came and we survived it, we should aspire, and that's our prayer, that we are all inspired to live a healthier life for our family, for our loved ones. This is a time where we take our thoughts and our mind off of our own self, and we consider others. Again, going back to scripture, when we consider others' hardships and we come alongside them and we take up their burdens, then we bless them, but we bless ourselves as well. So in service to our fellow man is really what we're talking about here. Even though we appreciate our health professionals, our doctors, our nurses, our EMTs, our frontline first responders, public safety, all of you, and all of those that are essential, deemed essential employees, you guys all have been doing exemplary, outstanding work fighting this virus with us as leaders, and also just keeping your people safe in your communities and abroad in Navajo. So my story goes that when I saw all those runners running by me, it took me a few months to get the gumption, to get the wherewithal to get out and run. And so on Father's Day of that year, 2020, my wife and my older son bought me a pair of running shoes. And I don't need another pair of running shoes. I have many, but I caught the gist of what they were doing. They saw me longing to run and get out there. And so on July 7th, I woke up 4:30 in the morning, cold turkey, just started running, and I haven't stopped since. Immediately lost 20 pounds right off the bat, commenced to eating healthier, living a little bit more active life. This pandemic did, makes us weary. And it's proven too that, when our mental state, and even in our own heart, I said earlier, as a man thinks in his heart, so is he. If we get downtrodden and we have lost all hope, then, it's easier to stay sick, to get sick, and to perhaps not overcome this virus. So we do wish you all to be well. Our Creator God, and God even wishes that we would prosper, even as our soul prospers, our mind, our will, and our emotions. So back to the mental health piece here, we all could stand to fortify ourselves, to become stronger, to come alongside those and to help those that right now just need some help, need the proverbial shot in the arm, a leg up, not a handout, but a leg up. So we do advocate for all those here, and whatever way that you can join us in this fight. Maybe it's just you yourself becoming a little bit more healthier, to do so, and to get active. Start by walking, then running, changing your diet. No more soda, right? No more rice, potatoes, all those things, flour, breads and all that. We could all stand to just find out. So, but do talk to your doctor to get their advice, and go on to becoming and living a healthier lifestyle. So I'll get off the high horse here, and I'll stop preaching to you and give you some updates now. So as you heard, our president, waiting in the wings is Carrie Watto from Zishnaudishle. way out there. But she's got a vital, strong message, being a dietitian herself and an advocate for a healthier lifestyle. So we're going to hear from her and hear the latest. So I hope and pray that you're considering it right now as I give these numbers. And so we have her waiting in the wings here. So as you know, I always bring the news in and around, starting nationally, but our U.S. death toll from COVID-19 passed the 900,000 mark on Friday. As of Saturday afternoon, data from the Johns Hopkins Coronavirus Resource Center showed that there were 901,391 deaths. The highly transmissible variant of this year now is of great concern. Right now, the studies are showing that they represent 99.9% of the new COVID-19 cases that are happening in our nation. The Centers for Disease and Prevention, the U.S. Centers for Disease Control and Prevention say people with the coronavirus are most infectious in the few days before and after symptoms develop, but the window of time might happen earlier with Omicron, according to some outside experts. That's because Omicron appears to cause symptoms faster than previous variants, after about 3 days after infection on average, according to preliminary studies. Based on the previous data, that means people with Omicron could start becoming contagious as soon as a day after infection. So please be vigilant, your surroundings and those around you, where they may have been. And so again, just mask up, wear your mask, and social distance. Clean your hands. Everybody's got the hand sanitizer. The 7-day average for newly reported cases peaked at over 20,000 on January 24th. 2 weeks later, with the Omicron wave falling as fast as it spiked, it was below 8,000 as of Monday. So total positive cases in the United States, 1,900,000, wait, this is Arizona, sorry, 1,926,240 with 3,790 cases. So we see cases starting to fall a little bit there statewide. Again, Arizona, about 7 million people, statewide population, just for comparison, and put it in perspective. Apache County, 21,100 total cases, 22 months into this pandemic, with 37 new cases to report. Navajo County, 36,435 with 126 cases to report. And lastly, rounding out our Tri-County area, Coconino County, 41,602 with 71 new cases to report. State of Colorado, the state reported 21,268 new cases in the week ending Sunday, near the high point of the fall 2021 surge driven by the virus's Delta variant. At the worst point of the current Omicron fuel wave in early January, the Colorado Department of Public Health and Environment reported more than 90,000 cases in a single week. Right now, as we stand in Colorado, 1,208,072, 21 months into this pandemic, with 5,521 new cases to report. New Mexico. The New Mexico Department of Health renewed the statewide COVID-19 public health orders today, including the requirement that face coverings be worn by people in indoor public places and spaces, except when eating or drinking. The orders also renew the mask mandate for schools reporting the requirements related to COVID-19 infections in the workplace and vaccination requirements for nursing home, school, and hospital workers who must be up to date on their COVID-19 shots. So total positive cases in New Mexico stands at 493,368 with 4,688 in the past 3 days during the weekend. San Juan County, 38,705 with 358 new 3-day reporting period cases. And McKinley County, 24,675 there with 237 3-day new cases to report. So Utah, rounding out our tri-state area, the rolling 7-day average for positive tests has increased to 2,611 per day. The rolling 7-day average for percent positivity of people over people is 36.2%, and the rolling 7-day average for percent positivity of tests over tests is 21%. Total positive cases, 903,771 with 5,504 3-day weekend count here on those new cases. San Juan County in the southeastern Utah, 3,814 with our own Utah Navajo Health Systems reporting 1,873. In closing, please get tested and stay at home if you have symptoms. Also, get tested 5 to 7 days after exposure to someone who is, you think might have been positive, and help keep our hospital emergency rooms ready for medical emergencies. Hospitals are reporting that people with no symptoms or mild symptoms are seeking COVID-19 tests at ERs rather than designated testing sites. Wearing a mask helps protect you from COVID-19. Please consider wearing the N95 and the KN95 mask. The only difference is N95s are US specific, and the KN95 is made abroad and has a little bit less performance there, but still quite admirable. 93% protecting variants and filtrants, and also it's just one of those things. Those are what the CDC is mandating right now and advising us for. So upgrading your masks today will help stop the spread of COVID-19. Again, if it doesn't say KN95 or N95, then you probably want to double up or just get some of the KN95 president masks here, which will be sent out to the chapters. So stock up there. You can hardware stores. I think many people are selling them now, and they are available. It's just that they're a little bit more pricier than the other masks that we were wearing before. But this Omicron variant is dictating that we get caught up with the latest KN95s and N95s. So vaccines have proven to reduce the likelihood of causing illness or death. Even with highly contagious and the Moderna doses at least 5 months, or Johnson & Johnson shot at least 2 months ago. So those are the latest updates there. So there you have it. I was long-winded, but still putting out great information for you all, and encouraging you, again, to change your lifestyle, setting the tone for our next presenter here. So ladies and gentlemen, I want to bring up Ms. Carrie Watto here from Zifnaudithle Health Office, for lack of a better word of describing it, but a dietitian in her own right, and also with great words, great advice on how you can maintain and change your lifestyle to become more healthier and live a more vibrant life. And that's what we all want to do. So, ladies and gentlemen, Carrie Watto.
Good morning, and thank you, Vice President Leiser and President Nez, for the introduction. I really appreciate that. I just want to introduce myself. My name is Commander Carrie Watto. Senajini Lishlan Toibahe Bashichin, Ashihin Dashanale, Tachini Dashache, Twin Nasha. But I'm currently working out here at Zitnahado Dithley Health Center. I've been a registered dietitian for 14 years within IHS, so I'm grateful to be here this morning to provide some information on nutrition. I'm going to just talk about a healthy diet. So a healthy diet includes nutrient-dense foods from all the major food groups. So all the major food groups include protein, carbohydrate, dairy products, fruits and vegetables, and fats. But from protein, we want to try to eat more lean proteins like chicken with no skin, lean ground beef, pork tenderloin, fish that's not fried. Some other protein sources include eggs or beans. Mutton is also a good protein source, but we want to try to trim off as much excess fat as we can before we do cook that. Carbohydrates, we recommend that you try to incorporate more whole grains like wheat bread, brown rice, wheat pasta, adding wheat flour when making tortillas, whole grain cereals. Also, blue corn mush and blue corn pancakes are also a good item. As far as dairy products, we recommend that you choose low-fat dairy products like 1% milk or skim milk, low-fat yogurts, cheeses, and then also trying to eat a variety of fruits and vegetables. from all the different colors because that is where you're going to get the most vitamins, minerals, and antioxidants to support your immune health, which is very important for fighting viruses. It's to incorporate more fruits and vegetables into our diet. If you're unable to get fresh fruits and vegetables, we recommend frozen. That's also a good option. Canned fruits and veggies are good too, but you want to be careful because some of them can be high in sodium and sugar. So look for low sodium canned veggies and fruits that are in 100% fruit juice. And then for fruits and veggies, we try to recommend that everybody get at least 5 to 7 servings of fruits and vegetables each day. So that is a challenge, but try to work toward that goal. Healthy fats, they come from olive oil, canola oil, and it also comes from foods like nuts and avocados. And the fats that you want to try to avoid is the saturated fats, which are usually found in lard and shortening, which could be found in pastries and donuts. So we want to try to limit those there. And some other healthy tips for eating, controlling your portion sizes. And that can be done by maybe using smaller plates and bowls during meal times. That way it helps us prevent overeating. Another tip is just trying to eat less processed foods. So usually processed foods are fast and easy to make. So, and they usually come from a box or a package. And those processed foods tend to be high in sodium and have less nutrients. So we want to try to avoid processed foods. Another tip would be trying to cook more at home with your family. Allow your children to help with cooking because they're more likely to eat the foods when they are involved in the cooking process. Try to do more baking, grilling, roasting instead of frying. Another great tip is meal planning. Try to do meal planning for the week so you're less likely to eat out and make unhealthy food choices. So create your shopping lists and then go shopping for those specific food items. It should also help with saving money. Some other tips would just maybe starting a garden so you can grow your own fresh fruits and vegetables at home, pack your own lunch for work, eat healthy snacks in between meals like fruits, veggies, nuts, low-fat yogurt, whatever you like. Also, we want to stay hydrated by drinking more water and sugar-free drinks like Crystal Light, anything that's sugar-free or anything that has a zero on there. Those are some good options. Another thing is just be mindful. Be mindful in what you're eating. Pay attention to what you're eating. Sometimes we get too busy in our daily lives that we don't pay attention to what we're eating, and that's when we make unhealthy choices. So just pay attention to what's going on. And then lastly, trying to exercise more for at least 30 minutes a day, and that could just be going out for a walk, feeding your animals, whatever your daily duties are, doing that for at least 30 minutes a day is a good exercise. Also, making small changes each week will lead to a healthy lifestyle. So, for example, if you're not able to make all of these changes, you can maybe make one change. So, for example, this coming week, maybe you want to just make one change by taking your lunch to work, and that could be a small change that you can make to live a healthy lifestyle. So I also recommend that if you have specific questions about nutrition, that you schedule an appointment with a registered dietitian, and they can go more into detail and meal planning with you. So that would be a great option. And that's all I have for this morning. Thank you for letting me be on the call. And I'm going to go ahead and turn it over to Dr. Fowler.
Shanale Shin Lido, Nanish Inido, Kodo, Ben Hisna Hassan, Na ADA, Shanale Dosh Chatching Kodotis Nahot Delida, Ada Azel. Because Anja Chian Chon any hits is but chon any hits is Satoye na on Shonhi a Kotoyen his Nahasnet. A Kotin hits is na Raja to the Anit a is Anit akol ishi itihi nitli yan lini ba apanasan John Hilne AD dairy na ishi a bet bil dal any ja da bankhanasan a low fat da bakai and lay cheese gezel but bidi ne ja al sato an etosanato ahosh da ajilneta ado protein nini jo it's na raj tla hashit I ta dalia tla it's da beige do ado dat eso the chicken bidi nini bakagi to nach opaji in ado and that's is ado hashine lai ani it's histal kan jo konde oshi abikino di lini da sabik ejis gish jo hot ayen da ntin aga the carbohydrate is nini di a loss when yeni jo esa dal nana sa dal pa whole grains nini ajiki na khaya at ne le anda le pata ajelle di pato ejito ajana khaya at ne do isi akani jiki oyon ashink kan nahat lehi eshi benina atan hilne ida dachit ada hat adet ahato shinweit go ahos in hat istrai ado din Troida, belasana, the fruits and vegetables, jo sago, da sanhit, ne nchaya at jo din hits east haho, ni hits os dan das odon hit def. Jo ishi chiyan chios, any and lady hat sade, ad the jono yik adon jono hut yilchahol in hits isi ko anit as anit dito tatan hit ninda sata wasipe ko satal kan jo ado di food process station lini yan lini ta ashtet and dahil niho jo edo na oslen hitne ajo ni benina kodo zait and do ajo it's easy dal nisheta anihi ni hits is na ajo yidisen do ya otka do ye ehosen okoti saturated is ne lineage that nil galda o you at the bihinte soti but the kato pastries is ne don't nasta chonta kan akon de eye goti lini do a shinkle kan bes eta it's ado shinkle jo Asian kodot ayen dan tin ado tsuda o api rahako hashine nati pita itani tan sago dan hiyana tan eta tsako jo belakanek at your portion o sen hisne up and hit speed ha natenli dan tinapa ni zitin hit bediki khalla waji akon so khabet kayete ako opet da atel ido at atel ako eshina sa to portion ne ado teach in yan isa hatet dahani slata o anstis kisto slata bit kanjikishi o you sorry shita o you besta jo da benna edo na kwaslen hisne ado na khaya at shik edo shne aho wade chia al enjiko na khaya at la it's da beige it's atjik besh thought it is based the door baka ita just a such a agent haya at engine a quanda hashine na njilne shoyo kedo la oshi ajishil hadat all with zin na hayu osha atol ni sha etol ni nini o aita chiya ta now agent his il woi a kodo ajukota edo do dan hisne no oste wajichiya oste naka achene ta pesni hisne adana honne aho wato ka ito tesi jo na hat ahi naka achene pebes nta an hisne Dik at the mobis condo on later in i disonne stabil in ara a egi at elna chatnio a con leo I da chia dalia ad ketni tikle jo ada adon healthy snacks celery carrots da jo chelnan sei jo astelne ado troda ada tlajon hitan hisne do shin ite achille da sto a copan so kesi de an hitting not out ishi ni hits is be what any ba a sin do it the agil the agil ho shin is do ishi aqua ba zin ado trahal zesi giti trattin da jinja da trahat zes na ho da chejerato it di fahi yo da kwa eto aqua khatisi ba aqua jinya according asa the more sa de schlichten som ada bisschen thing a ada hot ya kodo yen his na has net hits isi ba ha win zini binina ada tin berg sa to ben at de schlichten so edi is the element a registered dietitian dikne she added chian what a jeans either has no what I was not those in hisne but a kodobi kitty panit aba at wishne dole chinan dos che and lini kona he a chain nas nan dole edish che and lini Dr. Jill Jim it's this is that and it's this na raja ajishe kodo ni hit that san and na le dole Dr. Jim you have the floor.
Thank you, Dr. Fowler. As well, Shema Ake non sa ito kay Ninat Ani Nez and also Vice President Lizer as well. Thank you for your leadership in providing us information to remind us that we are still in a pandemic and also that this is a resource that we provide to the Navajo Nation people every week. So I just wanted to highlight the need to just let everyone know to continue to listen to our leaders here to continue to not let down. Although the numbers are going down, we have to always be prepared and vigilant. We're not certain when things are going to go away, and the numbers are slightly going down, but they're still high. So I think Dell will definitely re-emphasize that as well. And I'm Dr. Jill Jim and the Executive Director for Department of Health. And I wanted to thank Carrie for also providing information on nutrition and healthy eating. And I think during this pandemic, there's always a tendency to forget our bodies are probably very imbalanced at this point, and regarding where we're at in dealing with the pandemic or how worried we might be all the time, and just everyday life and stress does really play a large role in sometimes in our diet and our inability to probably exercise and eat healthy. And I just want to let everyone know, I think any tiny step that you do today, from Carrie's message to eating a smaller portion size or either eating more fruits and vegetables, I think are going to just be one step that you can continue to practice every single day. And that takes a lot of routine. And depending on where you live across the United States, some people might have more access to healthy food options. And here on the reservation, we don't have a lot of fruits and vegetables at our fingertips, but I think we can try to still incorporate healthy eating and exercising as well. So if you haven't taken out time today to exercise, please take time to do that, even just a small mental break. If you're working, walk a little bit, 15 minutes during your 15-minute break, or either if you're at home, do something for yourself today that you maybe haven't thought about. Take time aside to just reward yourself just for doing something for you today. And that might include things that we mentioned, healthy eating and activity. I feel like we used to talk about exercising and physical activity as a way to reduce these chronic diseases that we often see in our population. And now I feel like we have to have mental health in there. We have to have a really strong mind, body, spirit, and just ability to reassure ourselves that we can move forward every day, being an individual and who we are and taking care of ourselves, because we've been through a lot and we don't we've survived and we're here and we can make ourselves feel better. And that's what I think often leaders tell us, that to have resilience. And our grandmas and grandpas and nullies probably talked about that most of our childhood, and gave us those encouraging words to live the Navajo way of life, get up and pray and exercise. So wherever you're at listening, I hope that my message to you is to take time out for yourself, do something nice for yourself, reward yourself, and just be who you want to be today. And in regards to just living healthy and having a good, I guess, prospect in what we want to accomplish. So I just want to have that message. And regarding just the mass distribution, we're thankful for the response from the federal government regarding the quality mask requests that we submitted. And thank you for leadership for submitting that to the White House. And so we'll be working with the chapters where you can receive more than one mask. We have several masks that we'll be providing, and we'll have information on how to use it correctly. And maybe at the next town hall, we can provide more information to make sure that it isn't going to waste immediately, that you can reuse it if you take care of it properly. If you do have quality masks that you have bought already, just make sure that you look on the CDC webpage and other state health departments. I know we'll be having some media information on how to use it, when to use it, how to store it, and if you need to clean it or not, and just wearing it properly as well. So just instructions on that to make sure that we are in receiving the quality mask. We want to make sure everyone knows how to use it properly. So so these will be distributed to your local chapters. So in the next week or so. So just continue to follow up with them to see when they received it, and when they may be made available for pickup as well. So that will be coordinated with the Division of Community Development. So, and ikeha da isunot angishin o shin iso o hasti to o bel denek etishin o shin eta ta hinya do jo da a down do kwadi exercise on yani do a hot iso kwa be hasti do o shin no so kwa hot di hate a da da iso adan sin keso la hate ada itida beyond and nayat the yink dot or the I'll take a walk as well and things like that. So iso dog adeya. I'm going to hand it over to Dell. He's with the Epicenter, and he will provide us information from the gating criteria. So Dell is a very valuable member of our HCOC team, and we are working on this every single day and every single week to put these reports to use to see where we're at in the house. Appreciate all the health facilities and the Navajo Nation Epicenter for work every day, and so we can remain safe here on Navajo and making sure that we are monitoring. So so Dell, take it away.
Okay. Thank you, Dr. Jim. And President Nez and Vice President Lizer and all my colleagues, my Natanis, joining the town hall. My name is the Epidemiology Center and also our epidemiology team. And this is the update that we have for our gating measures for Navajo Nation. 2-week time period from January 21st through February 3rd is the analytical time period. Just to show you some of the latest numbers we have. But before I go there, I'd like to show this slide just to acknowledge our epidemiology team. We do have a large group representing different organizations from our own Navajo Epicenter, IHS, and 638 facilities across Navajo Nation, CDC and CDC Foundation, our partners, and from Hopkins and COPE and TGen, who's helping us with the Navajo Nation COVID strain surveillance. It's where we learn about all the Delta and the Omicron variants. That's in partnership with TGen, and of course our state partners from Arizona, New Mexico, and Utah. So we are a big team, and just want to acknowledge them for all the work that they're helping us with on COVID disease surveillance on Navajo Nation. This is our 60-day time window for recent cases and trends. As you can see, has been mentioned, we're on this downward trend, seeing less cases. But Dr. Jim had mentioned, but we're seeing less cases, but they're still very high. So this first peak is about around January 11th. And then this next peak is around January 18th. So since the 18th, for about 3 weeks now, we've been going down to seeing lower cases every day. So it's a great sign. Our 7-day infection rate is at 0.81, continues to go down as well. Again, that's also a good sign. This is our case incidence across Navajo Nation. There were 1,169 new cases over a 7-day period from January 28th through February 3rd, which puts our 7-day case rate at 738 cases per 100,000 people. So this did go down as well from, there were almost 700 or so less cases this time around. And on the map here, you see a lot of red still in some of the IHS service areas here, including our bordering states, and only Tuba City and Fort Defiance service areas. Just a little bit of less cases for those service areas. So we are remain in the red. Some additional metrics here, the test capacity. We went back down to 34% from 37% last week. A good sign too. Testing did go down a little bit, but there's still a lot of testing going on. About 1,300 average daily tests were conducted over a 7-day period. So a lot of testing going on the nation. Our hospital capacity, we remain below 80%, and that's our threshold. So that's also a good sign. Regular beds at 57% occupancy, and ICU beds at 72% occupancy. So below 80%, so that's good. And this will be updated, I think, later today, but this remains unchanged because we presented this last week. About 120,000 are now fully vaccinated, 64% all residents fully vaccinated, and then 74% of the eligible residents ages 12 years and older. So these percentages do continue to go up. People continue to get vaccinated, also fully vaccinated. So that's great as well. This is, I think President Nez showed this, our epidemic curves for the US in blue line and Navajo Nation in orange. We do have these similar downward trend patterns between Navajo Nation and the US. So less cases on the nation and also less cases across the US. And President Nez also showed this. This is just a 7-day incidence comparison of COVID cases between the Navajo Nation in yellow here and the 50 states and a couple jurisdictions. So the red bars are the Four Corner states. We did, we still hover around the same area as far as position ranking, comparing Navajo Nation to the U.S. But we are still seeing a lot of COVID cases around us, especially in Arizona and New Mexico. 7-day case rate picture here across the U.S., as I mentioned, Arizona and New Mexico with this dark shade of blue color, with still seeing a lot of COVID cases within our region, and Utah too, a little this blue color as well. So a lot of COVID cases still within our region. Community transmission for COVID, you see a lot of red here, remains high across the U.S., especially within our region. All the counties within our within Navajo Nation remain red. This is the COVID strain surveillance. As I mentioned, with our partnership with TGen, this was updated yesterday, report 41. So comparing report 40 to 41 here, Omicron went from 560 to 921. So that's an increase of 361 new Omicron cases on the nation. And then Delta went up by 10 more cases from 1391 to 1401. All the other variants remain the same. So these are, for now, we're really seeing a lot of Omicron cases being detected on the nation. And it's overtaken more and more cases at a higher rate currently than Delta, although you see a lot more Delta cases, but Omicron, we're seeing a lot of cases currently. And then this is the CDC variant profile across the US. The purple bar is the Omicron variant. It's really now the predominant variant currently still. Almost 100% of all variants are now Omicron variant across the US. This is the high-risk chapters for this reporting period. There are 83 new chapters that made the list. Last week was 85, so it kind of continues to go down as well. So it's a good sign. And then timeline going across this way to the right, and this red column over here is 6 weeks ago. So December 24th. So this is the 28 chapters that have been on this list for at least 6 weeks. And then finally, just risk level assessment. Our cases remain high, although we're in a downward trend, but it is still a high number of cases. Keeps us in the red threshold, likely driven by the Omicron variant currently. And Omicron variant was first detected back on January 3rd, 2022, so about a month and a half now. So test positivity remains high. I mean, it's a good sign that it went down from 37 to 34%. And hospital capacity, another good sign that we remain below 80%. So, and last, where are we right now? We remain in the red, cases, testing, and hospital capacity. There are two different colors. The higher level is selected, so we remain in the red. And I'm going to stop here and stop sharing my screen and hand it over to Shema, Dr. Fowler. I'm going to hand it over to you. Thank you.
Na Hashiyash Adon Hish Nahasan Naigi the Gady measures they snap na to cage case Twisani Arch Z into the message Arch a yan das Kahido Kodo na kitchen kon na ehon na hishin tahadne akodina al kahi e yasin is na dino asa ayos kasadon le atapiyaj ka ayos kasade ita na as kaigi ahisne Akodek at Yaan Nilchik Edoshidne, Akoyaan Nili Bahe Nitzen, Kondahala Eya, Dit at the aid, Belagana, Aji Yenda Alkai at Lichi on that says kid, Ekoti Etos Ginger A, Asla de Media, Asla Nezatin, Asatino, Anast A, Jokonet La Eya, Beta del Nande, the Quishi Eya. Slato itado ya atenta letter A is el idol sachi is it bahatal yanda apeta hetelne ado yeko peta hetelneto is el un bandaho I is it ho bahatal ne inki jo ishi to baho no sendo yen hisndahne according to alkhan lini tesit lini jo at the adequate kid ocean EU sata o is that need koson de ich didn't lila yi yash was not that citizens that a arja test capacity yi eight at the decosil kit other the is an test capacity has go at the capacity has other the is it been up in el yaido bang yai Asad nezatino anatin de milias do ana kidnezatino atatino atos Kone la eti de nevapato ka kedat ini kone la ze bahatalia ado dina hone today's kideye go ya ani di islatin khahotso bi do eya nihina go to ya ata ni ko ai yan his behosen do len his nadin hit de nebel khahotso a ka e do ya ani kondin hina go AD County for the hot so go to Santa Atletis Nas Ango RJ at the oil Hotatus Kitcho Ashi hit that na Ashi Benina. Akoti Ado the Cosnas 8 at Tapeti Nido Omicron Nabedi ne Delta Tapeti ne Jo A Saho and or Nesliki A Omicron A Ya Tadne Zantino Antistino Asa Pe Deconades Kit. Oko afinates of nas ednes atino anatino asla enal kip. Ado di delta bedi nini ednes na decopit na des kit ek at asla de milias antis didines atino asla coil kit. Ako at ende afinates of ya as tadnes atino anti punella ebi decona des kit. Afinates of di distinto asa il kilti report 41 yusne na kid de media do askan nezatino atos opanella ya di very ipetator na alona kone di recommendation risk level yusne kha illa ati ka atish so chi is to ati chi on next kid Okodi lahan or nidi as estra o your cousin da RJ Quadradin Hikahotoi be Bohon Adon al Kai at the Deco Z and Besnahas Ango a son and not kitchen Edo Shidin Gonsagosin Kodon Haba at Nahuish Netole Yana and Hidini dole shady my deshkis in strong for the cheating Bashing. Alo trapa edashi church ashi edashi nale todos ahol yere ane yisin shike kokodo aj na or ke ben yisin tahune ako Reit ashten etta achaya sa ahot sa ta bezar jo etta achaya ni ahot zinj Quits isiki exapa aquajilian le haket adon le hatsit aj ado hakela hat ishi kehishi bishdene lase bishdene laniki I jasho jo kwa hake and then haket hal haket ate jo ishi tatoi disney adon le hajagi hakogitai disney adon le hak ado hanion na jo yo hatis ado dir Kaneteta manasi kayete klan hachash as the ne ado osgani da yent in hat sits in da nani ka jo at artischne hat is jo ha itatnes keko do yat donna ilna ha na hunst da na tatine an an sisi ha joban sin keso ha leit edo ha tila be ela jo kojo registered dietitian ne chinyan chil any be pa ahoni zeno ya jashi lakhande slata chinyanti khala wala do lakhanda joti ne sto any hitsisi kwa en hizze git lakhan yosen adon le ni yon ati ni kodin hitsade do da yitne na ko Eshina koto ze il iniyeta ani yen hiln tahalne hajo chiyani chos eliki to sanko chiyan pes etas echon hitne hashine na sata osa shata jotlose ilan yo chil chos kahanin le tasit no da jo sisi be ta akashia kopan na hadil it yasetne ni lini do di vegetables nini dash beige dat escota itash et el yago do tota o yo getan hisne do di vitamins that they are building your own vitamin jo sato bene ba chiyan ya at de ta en hit season nini altsoni ich nido ich betsketini hits in das agon hits os hit der dan ligo shina ya ahalia akochiyan chil inin hits ansla yo ligo jo sa ananat akoti vitamin D hit nini di konjona jo sitole ya und ito chirahoda na hodini dohoda ya at sa to vitamin D hat osan ligo beta di to jo njonen kodin hit ise asa bahanosen ha ishin le khalati etatat angota jo sahoj na nista ajis on natalto is ne kodon hinat ani do zein be eta akhostia do ta ket na ta wishi jo ajin antin ba na ta hotlo ta est eta holle jo kena ta liej na ta khwel ji so chantin lo ne kha jo ajin na ta do dina yize jo ad eketa del ye jo ad pa na ta hote ne do ha ishi hat istra ya at ho yosani do zini ein taka jo ha ida da zis on jone le konta del klamashin jona til da etra na hases do ha ishi bistene nashi nicht die music that is near sa shanata hato la jinson ajita o da honzaje be na hat sie so hisne when se kesi is solo ne yo li she bin not to art and it nido but system zin after she edo shidne kodon hilchina da hasit do ledo da holia nitis ba holia do nihizada ba holia nihina nihija do elan hits other do tasni zinda do is die do junda do jilni ho da khana da do jo do khago da do jo ego shin do ya eta ena ani he be ta huilia do an is ba huilia ha ishin chin ishin ha jonan shoti da shaya at de kojit khan de koje ba hullo tlatania ena ha joche jos indo be na hishin tinoshi at ko ho wa de so tahi adon ka alchinin hitoken hinalake things and the Quahanella she the Kambaka, Hanella she be a Shamne at all Neatons on Abanash this kitchen dole. Just 3 Suzani he had Chicago shouldn't. Shamaya Keshi Yard Shamasha Beje. So Tilike Ado Shana Ketashinta Nosne Ado Kebedak Ehi at the Hosia. Do tachata alsi ilkiston sadia bechi adatki yon ne akwitje do dizli dit adamne bahas ada akwitje yota hino ne yota hino nido sadia bechi adatki nasto ne ina behena da iltito enitzen. But I could on the catch na nishlado le na he then that so gizzy nijano he that ado is cardon le na hijinjano nihenna de hat or le edo shidne ashkon de da hosia hakone